An immunologist says COVID-19 continues to have unequal impacts on Pasifika communities in New Zealand. People are being urged to get vaccinated, wear masks and use antiviral medications following an increase in the number of cases in Aotearoa over the past 2 weeks. Alicia Foon spoke with immunologist Dr. Diane Sikapautonu about the importance of prevention ahead of winter.
I think it's important for us all to remember that here in Aotearoa, New Zealand, we are heading into the winter months and COVID is still here with us, and that the underreporting of COVID-19 has continued, and of course this is no surprise to us now, but it has, it still is a concern. The other key thing to bear in mind is that COVID has unequal or disproportionate impact, and that we know and we have seen that COVID has exacerbated pre-existing health inequities for different groups, and this also includes for Pasifika peoples and also for Māori, and that from time to time these inequities have come to the fore. For example, hospitalisations for Pacific peoples and for Māori for a time had been higher than for other groups, and so again, just coming back to bearing in mind that COVID does have an unequal impact. The other thing for us all to bear in mind also is that new variants of the SARS-CoV-2 virus do continue to emerge, and that currently here in Aotearoa, New Zealand, JN1 is responsible for the majority of COVID-19 cases. So we know that the virus is changing all the time, and that these new variants do continue to appear, and that these newer versions of the virus have caused a lot of problems with higher transmissibility. And so JN1 is one of these newer members of the Omicron family. And perhaps maybe just if this is helpful, Alicia, that JN1 carries a very high number of mutations on the spike protein. And so remember, the spike protein is how the SARS-CoV-2 virus gets into our cells and causes COVID-19. And so it's important to know that there are very simple and straightforward steps that we can all take moving forward to help prevent COVID, but also that these prevention steps for COVID also help prevent other illnesses as well. And so, of course, bearing in mind that we are moving into the winter months, that the spread of other seasonal illnesses is also important to bear in mind. So wanting to minimise transmission remains important. And again, just coming back to the really simple steps that can be taken to manage and prevent COVID-19. And so, for example, we've all seen how COVID-19 vaccines, boosters, tests, masks, and antiviral medications are all really important for managing but also dealing with COVID-19.
Can we talk a bit more about prevention as well? Here in Aotearoa, New Zealand, we no longer have to isolate. I guess there's now a lot more of a relaxed approach. However, COVID is still very much impacting people. We're seeing this in the evidence of the number of cases and even the number of deaths that are still happening. Could you talk about what we can do in terms of vaccines and boosters, and also just reiterate those important messages to prevent the spread?
We're needing to minimise transmission of COVID, and this remains really important. And the steps that we can all undertake are really simple, and they are ones that we've all been doing to try and manage with COVID-19. And this includes COVID-19 vaccines, COVID-19 boosters, testing for COVID, having access to masks, but also antiviral medications are all really important for helping prevent but also manage COVID-19 moving forward. So although COVID has been a key focus for all of us over the past years, it's really important that all vaccines are still important. And it's important to remember also that cost remains a significant barrier for many here in Aotearoa, New Zealand, and that it's key that people get access to what they need at the time that that they needed. So we all know that prevention is better than cure. So if we can prevent people getting sick, this is way better than trying to treat them after people have become sick. We can't afford to have people getting sick if we can prevent sickness in the first instance. And people can't afford to become unwell either. And it really doesn't make sense that if we can prevent illness in the first instance, that we should be able to try and do that. Businesses, schools and workplaces can't afford to have people off sick as well. So in other words, preventing an illness is much better and cheaper than trying to treat people after they've become sick. It actually makes sense. It makes perfect sense to do everything that we can to stop people getting sick in the first place.